Thank you again for joining us today as we seek to provide regular, up-to-date, accurate information about COVID-19 for our community. We're going to start these briefings with some gratitude. I'm very grateful for Mayor Jacobs for covering the test, the cost of the test for COVID-19 for our uninsured residents. Like social distancing, testing is a critical tool in the fight against this virus. And this move will help ensure access. Patients must first be screened by our team members by calling our public information line. We've received several questions about the safer at home order. And when can we see results? When is all this altering of my schedule and altering of my life going to produce the results we want? We will continue to evaluate the situation as we move through the order. I understand that we're asking our community to do an awful lot right now, but we need everyone to do this because it is our collective impact that is our power. Only as a community, all of us doing the social distancing piece, businesses closing, making choices, that's the only way we're going to start to see a change in the number of cases of COVID-19. It won't happen right away. It takes time, but we know it works. It's an effective, proven public health tool to reduce disease in a community. Now on to just kind of the situation update. We have 28 cases at this time. 5 of those have been hospitalized at some point in their illness, and 6 have recovered. A pandemic such as this is a difficult and concerning time, and health departments all over the country are coordinating an unprecedented response, but panic and fear are not helpful. We must follow the guidelines and stay informed. Education is power, especially in these situations where things are so uncertain and unclear. I encourage everyone to continue to find creative ways to connect with their friends and family in this time of physical separation. Every day I hear stories of extended families having virtual get-togethers, neighbors checking in with each other from their yards or across the street while maintaining a safe distance. And those businesses who are designated essential, finding creative ways to keep their employees and customers safe. Finding small joys and unique ways to come together in this time is crucial. And I encourage everyone to keep it up. Our faith communities, our neighborhoods, and everyone. Thank you for what all of you are doing. Thank you for what our community is doing. And again, thank you for our media partners getting reliable information out there to our community so they can make informed decisions. Thank you. I'll open it up for questions now.
One question.
Yes.
For people who are curious why, I guess I would say, why the county does not release more identifiable information about those people who tested positive, even if it's just a neighborhood or a street or a section of town, can you address some of those?
Sure. Thank you. Thanks for the reminder. So the question is, why has the health department not released more identifiable information about the cases, maybe a neighborhood, maybe an area of town? There are a couple of reasons for that. One is really privacy. Even in situations like this, our privacy does not totally go out the window. People still have privacy. The other is that when we are able to reach the people most at risk from that person, their closest contacts, and easily get a hold of them, inform them, tell them what to do, tell them what to watch for, we do that. So when we can do that, so we start with those folks closest to the case, those people they see all the time, people they live with, people they see, spend several hours with, and then we move out from there, and that's how we risk stratify those groups. When we're able to reach those people easily and inform them, there's no need for more public information. The patients, when they're diagnosed, are placed in isolation until they're no longer a risk to the community. Their close contacts are asked to self-quarantine and watch for symptoms. If they develop symptoms, they're placed in isolation. It's something that we do regularly, and it's a proven way to reduce disease in our community. So we feel comfortable with using that method in this situation as well. Okay. So the question is, any information about nursing homes in our community? Are they being tested? I don't have any specific information about nursing homes and whether patients at nursing homes have been tested at this time. What I do know our nursing homes are doing and our assisted livings are doing, they're restricting visitation. You can't visit anybody unless you're there for end-of-life care. Their employees obviously can go in. The people that bring supplies can go in. But they're not bringing the woman who calls bingo in anymore, and family members can't come in. So they're doing that to protect their residents. And it works. We know that if we don't introduce disease into that community, those folks are going to stay healthy. So they're following the rules and the guidelines really well, and I applaud them for that. I know that's hard. It's hard on their staff, and it's hard on the residents as well.
I have a question about,
These are two questions that both relate to businesses.
Sure.
We know of the businesses that specifically there was a furniture business that does retail and wholesale, and they're keeping the retail portion open. You've got big box stores like Walmart, Target that have pharmacies and grocery stores, but they also sell non-essential, that are things that aren't allowed to be sold in non-essential stores, like clothing stores that are locally owned perhaps. And you also have national chains like Joanne, the Fabric Center. I don't know about here, but in other places, they're staying open, claiming that they supply home businesses. Where do you draw the line between something that's legitimately a distribution business and something that is that's a minor part of the business, or they're keeping a retail side open anyway?
Okay, so I'm going to paraphrase your question. So the question is about the Safer at Home order as it relates to businesses and essential and non-essential businesses, and the challenge that some businesses some stores that are larger provide an essential service, but they also provide some of those non-essential services as well. We're unable to make that distinction with those large facilities. We want pharmacies to be open. We want people to be able to get groceries and get their medications. So those are going to stay open. When we think about other businesses locally, if you're considered a non-essential business and you're remaining open, if people are aware of those, we want them to let 311 know, and our staff will be following up with those facilities and explaining to them the Safer at Home order and helping them to get into compliance. We have staff who will be doing that. So again, if people have concerns or questions, there are a couple places to go. One is to go actually read the order. It highlights pretty well what the non-essential services are and non-essential businesses. And then if you go and click on that PDF from CISA, which is a national organization that helps guide communities as they plan for these kind of things, and they list a large number of essential businesses. So people might think that's not an essential business, but when you look at that list, maybe they do fall in an essential business. So look at that list before you call or before you jump to conclusions that they shouldn't be operating. Because people still need to get things done. People still need gas in their cars, and people still need to get their cars fixed because people still do have things they have to do.
My follow-up question was specifically about restaurants. Hasn't been an issue since it's been raining most of the last few days, but a lot of restaurants, both the more traditional dine-in and fast food restaurants, have outdoor dining areas. And how does that work with the carry-out, delivery, drive-through only?
So the question is so at restaurants that have outdoor seating, how does that work? How does the order work with them when we're saying they have to take out or to take it off premises? So if we use the word on-premise and off-premise, it makes it a little more clear. There is no on-premise dining or drinking, right, at restaurants or bars right now. It all has to be off-premise. So their outdoor seating area is on-premise. So we are telling them not to serve people and let people sit in their outdoor area to consume those beverages or that food. That must be taken off-premise to be consumed. And our staff will be, our staff that regulate the restaurants will be doing spot checks and again helping those restaurateurs get into compliance with the order.
Yeah, I wanted to ask about the proposal to test uninsured Knox County and where that money is coming from, if that's already established in the budget, coming from already existing budget allocation or pool, or is that new pool of money?
My understanding is that it's part of our existing budget, and that money will be used to test folks who get screened by my staff and have to have symptoms, and then they would get tested so that that would help improve access for those folks who might not otherwise be able to get tested. So we're very grateful for that.
Is there a cap on that, or is it we'll have to see how many tests there are and then pay for that?
I think we'll have to see how that goes and see where that goes. The mayor's very committed to increasing access to testing, so we're grateful for that. And we believe there'll be some, because of the declaration of a state of emergency, that there could be federal or state money available later to recoup those costs. We don't know that for sure, but we're hopeful.
There's a group of doctors across the state who are insisting that the governor do more restrict public movement. What are your thoughts about that?
I think I'm actually aware that there are some physicians who have signed some petitions asking Governor Lee to make some stronger recommendations. I know Governor Lee is consulting with public health experts at the state level and others to make those decisions and talking with local jurisdictions. Certainly we will comply if he makes a different decision. He's also allowing local jurisdictions to make their own decisions, as we did here in Knox County.
If you have people over to your house, is it still okay to have less than 10? And should we keep the list of everyone that you came in contact with, just in case one of them finds out later they were infected? And also, can you explain again, if you're not really that sick, you don't have to go to the ER?
Sure. So the first question was about if I want to have a party at my house or I want to have dinner with some friends at my house, is it still okay as long as I keep the number under 10? Yes, it's still okay, but you still need to follow those social distancing guidelines. You need to be able to try to stay 6 feet apart or further. So that might be a challenge for some folks. And I also asked, should I keep a list of the folks that I come in contact with, just in case one of them tests positive for coronavirus? You certainly could do that if you want to. Basically what happens is, if somebody's diagnosed positive with coronavirus, we're going to go and we're going to ask them for their history of what they've done 2 days before they got sick, and we're going to be reaching out to those folks anyway. So it's not a bad idea, but not necessary. And then you had a second question, and I don't remember what it was. Second part to that.
I think it was about whether or not you feel sick. Should I just go to the
Right.
emergency room?
So the other question was just some guidance on when you should go to the emergency room. So if you feel sick and you would normally not even call your doctor, stay home until you get better. If you feel sick and it's something you would normally go see your doctor for, pick up the phone, call your doctor, tell them what's going on, and with your doctor make that decision about whether you need to come in and be seen by the doctor and perhaps tested. If you are so sick you feel like you need to go to the emergency room, you're having trouble breathing, you're having shortness of breath, you're having chest pain or something like that, by all means we want you to go and be seen for that. We do also want you to if you call 911, let them know what your symptoms are, what your concerns are. If you're going to drive yourself to the emergency room, we want you to call ahead and let them know. They'll tell you what to do and how to get into the ER without having to go through the lobby. And that reduces the risk of people who are there for other things, like they broke their leg or whatever, from being exposed.
Dr. Lisa Piercy said the other day that right now there's kind of a lag in processing the tests because so many are now coming in. There's only so many venues those can go to be tested. So it may look like numbers are increasing very slowly, but that's really more an effect of the processing than it is the actual spread of the disease, indicating that we might see once the processing labs chew through all these tests that are coming in, that we'll see that number go up more. We expect the same thing to happen in Knox County, again, 28 in a county of more than 200,000
So the question is around what Dr. Piercy at the state said about the fact that there's a little bit of a lag time in reporting of labs because it takes time for the labs to get those tests done, and there's such a volume of tests coming in to be performed. And she said, you know, we might see a pop-up of the number of tests in the state, and do we expect to see the same phenomena here in Knox County? And the short answer is yes. We do expect to see that, that brief pop-up. And, you know, what our hope is that as those labs that are performing the test, as they increase their efficiency and they're put through, that'll kind of level off because the labs will get processed more regularly, and you won't just get a batch of a whole bunch of positives in one day. Hopefully that'll just, they'll come in at a little slower pace as those labs get up and are able to process more labs. And as more labs come online, that's happening too.
One more about neighboring counties. Have there been any talk about safer at home orders in neighboring counties at all?
So the question was, is there been talk about safer at home orders in neighboring counties? That's a great question for the leadership in those counties or the public health leadership over those counties. I'm not aware of any, but again, those would not be conversations I would be privy to.
We have actually time for one more.
All right, we get a lot of emails, people concerned about the homeless. Some people are saying, confirm or not, that some homeless possibly were tested and haven't had the results back. Do you know if they're being quarantined in hotels or anything about that?
So the question is about the homeless. There are rumors that some folks who are homeless have been tested, and are they being quarantined in hotels, or how is that being managed? So if a homeless person is tested for coronavirus, just like anybody else that gets tested for coronavirus, until the results come back, we ask them to be in isolation. And just like we do with other things like tuberculosis, if there's a need, we as public health are expected to provide suitable housing for that person while they wait for those test results. So that obviously is a challenge. And we are working with multiple community partners to address just that issue on a daily basis, trying to find us to kind of standardize that so it's easier for the person and the hospitals or doctors doing the test as well. So it's a complicated issue, but it is something that we do. We do it sometimes with TB cases if we need to provide them housing. So that is an obligation that we, as public health, if you don't have housing and we're telling you you have to be in isolation, we have to help you find a way to be in isolation.